Hi, this is Dr. Launice coming to you again with my Monday Medical Minutes. I take care of sick babies for a living, and I've been doing these videos so I can let moms, dads, parents, guardians what to know or what to expect when the unexpected happens and your baby is admitted to the NICU. So I've done a video talking about what happens when the uterus is infected. I've done another video talking about what happens when babies have trouble breathing because they have extra fluid in the chest. So please check those out. But what I want to talk to you about today is something called hypoglycemia. So what is that? That basically means that baby's blood does not contain enough glucose or sugar. We consider a normal sugar level in a baby to be 40s to 60s, but really the happy place is going to be 50s and above. And the reason that we care about this is because we know that if a baby has a low blood sugar level for a prolonged amount of time that's not treated, they are at risk to have damage to the brain, which can affect their growth and development later on. So what are the causes? Why might a baby have low blood sugar? I'm going to talk about the most common ones, and one that we see a lot is in babies who are born to moms who have diabetes. Okay, so a mom could have had diabetes before she became pregnant, or she could have been diagnosed with it during pregnancy because on her regular screening tests, her glucose levels are found to be elevated. And the reason why this affects the baby is because the baby lives inside mom and gets all the nutrition and support by way of the placenta. So if mom has high blood sugar levels, that's going to travel through the placenta to the baby. And now the baby is sort of living in this high glucose, sugar-rich environment. One of the responses of the body that's a natural response is to release a hormone called insulin. And the job of insulin is to bring that blood sugar level down. So this baby is living in this high sugar-rich environment, so the response on the baby is to release insulin to bring it down to normal. This comes into play now after delivery because the baby is no longer getting that extra sugar-rich support coming from the placenta. The umbilical cord is clamped off. So now the baby has to rely on their glucose stores in the body and from feeding to keep the blood sugar level where it needs to be. But this insulin that was being released during pregnancy is still circulating in the blood and is still working to lower the glucose. And essentially the baby gets behind and is unable to eat enough to keep the blood sugar, the blood glucose levels normal in the setting of this insulin. Some other reasons why babies can have low sugar levels is if the baby is born early. More specifically, I'm talking about babies who we call late preterm because they're delivered between 35 to 37 weeks. So these babies do not automatically have to come to the NICU like babies who are 34 weeks and below. But because they're early, they can behave a little bit more premature and sometimes have difficulty feeding. Sometimes they need breathing support. And again, sometimes they may not have enough of that glucose stores in their body or fat stores in their body to help maintain normal blood sugar levels. Another reason could be if the OB lets parents know during pregnancy that the baby's not growing well. And this can happen if there's something going on with the placenta and it's not working properly because that's the way that the baby gets their nutrition. Or it could be if, we know for instance, that moms who are smoking, those babies tend to be smaller. And again, when they're smaller and their birth weight is lower, they have less benefit of those fat stores. So again, their blood sugar level can be low. And for sometimes parents who are a little bit smaller can have babies who are a little bit smaller. And again, that just puts them at risk to have a lower blood sugar level. So how does this affect the baby? Most babies actually don't show us any signs at all, but because of the reasons I mentioned, if baby is born early or we know the baby wasn't growing well, or if mom had diabetes, then we go ahead and we check the levels because we know that they're at risk to have them drop low. But the majority of babies won't show us any signs. If they do, there are certain things that we can look out for. One is that the nurse may call us and say that the baby is jittery. And that's just when baby has like these shaking or tremor movements of the hands and of the feet. That can be a sign. Another sign can be if the baby has trouble breathing, is either breathing fast or taking pauses in their breathing. Sometimes they might look blue in their face, presenting with something that we call cyanosis. Sometimes it may be that the baby has a severe sign and is actually having seizures, and that can occur for many different reasons, but one of them is low blood sugar level. So what are we going to do? How do we treat this? Okay, so if it's something like seizure, which is an emergency, we're just going to go ahead and take the baby right away and treat that. However, if it's because baby's born early or, infant of a diabetic mom, okay, we can go ahead and just say feed the baby, let the baby eat and see if the sugar can come up after feeding. So the baby can either go to the breast and breastfeed or take a bottle and get some formula. Now, there's a chance that it may not come up just with breastfeeding alone, because we know that mom's milk will not be in yet. She won't have had milk let down, because that's normal. But for a baby, right, who is dealing with these extra insulin that's been secreted all during pregnancy and now is still working against the baby to bring the sugar levels low, we know that, they're going to the breast, they may not be getting enough milk to keep the blood sugar level where it needs to be. Also, again, for these babies who are born early, again, who have those like lower glucose stores, the lower fat stores, again, if they're going to the breast and they're not getting very much milk, that might be another situation where they have a hard time keeping the blood sugar levels normal. So we might say in those situations, after one feed, let's go ahead and give formula, just because we expect a better response from the formula than breastfeeding until mom's milk is fully in. So after 2 or 3 tries of this feeding and the sugar level is not normal, at that point we may say, well, we need to bring the baby to the NICU so that we can do something to take care of these sugar levels and bring them up where they need to be. Or if we've had 2 that are very low, less than 40, we'll just go ahead and say, let's get the baby. So what do we do in the NICU to fix this? So we'll do a small stick and put an IV, which is a small catheter, into the baby's veins so that we can give fluids. And we need to give these fluids because these fluids contain dextrose or extra sugar, so that helps us to bring the glucose levels up to where they need to be. In a baby who's still having a hard time getting those sugar levels into the normal range, sometimes we put a special IV in that goes through the belly button, and that's just because it allows us to give a higher amount of sugar or glucose to the baby to bring the levels up to where they need to be. The baby, if the baby's otherwise doing fine, is breathing on their own, is not getting any respiratory or breathing support, then baby will still be able to breastfeed and will still be able to take the bottle, and we'll just be giving this extra fluid to help bring the blood sugar level up. In a baby who didn't have the risk factors that I talked about before, the history of, mom having diabetes or being born early or stress at delivery or something else that could explain it, we may do some additional labs and tests to look for infection, because that can be another reason sometimes why the blood sugar level is low. Or we might just look at electrolytes as well to make sure that there's no other reason that could explain why the baby's blood sugar level is low. So now you're like, okay, my baby's in the NICU, you're giving these fluids to bring the sugar up. Okay, so how long does the baby need to be on the fluid, and how long does the baby need to be in the NICU? So as we keep checking, we're going to check the sugar levels before the baby eats and after the baby eats to make sure that they're normal. And if they're in that 50s to 60s range, then we can start turning down the fluids. So once the baby has been completely off of fluids and the blood sugar checks have been normal for a full day, that's when you know that your baby is ready to go home. And if we did any other labs and tests, as long as those were normal as well, and there's no sign of infection or anything else, that is when your baby will be ready to go home. Finally, parents want to know, what does this mean for the future? Am I going to have to be checking the baby's sugar levels at home? Is this going to affect their development? And the answer is no. For the majority of these babies that, probably didn't have any signs of low glucose, but were being checked because they were at high risk, they respond right away and come off of fluids within a day or 2, we know that the majority of these babies do just fine and are at very, very low risk of having any issues with their development. And a baby who may be presented with, seizures or difficulty breathing, these signs that the glucose level was low, it's 3 or 4 days later and they're still requiring extra fluids and they needed that special line and a high amount of glucose to treat their levels. That is a different situation where, again, that baby might be at a higher risk to have some impact on their development later on. But again, for these babies that I talked about today, the majority of them are going to do just fine. So once again, this is Dr. Launice coming to you with my Monday Medical Minutes. Thank you for tuning in. Please go to Facebook, type in @Dr. Launice MD, like my fan page, to stay in touch and to get more information. Please leave comments below to let me know if you have any questions or to let me know about some topics that you would like to hear about. But thanks for tuning in, and I'll see you guys next week. Bye.